How do hospitals coordinate stroke patient transfers? When seconds count in a stroke, hospitals work together like a well-oiled machine to get patients the right care as quickly as possible. It all starts with recognizing the signs of stroke and calling emergency services. Emergency medical teams then follow specific protocols to decide where to take the patient based on how severe the stroke is and how far away the hospitals are. If a patient shows signs of a large vessel blockage, which might need a procedure called mechanical thrombectomy, EMS will try to take them directly to a comprehensive stroke center if it can be reached within a certain time frame. This usually means the hospital is within about 30 minutes of travel, and the total time from the scene to the hospital should not exceed 60 minutes. If the comprehensive center is too far, the patient is first taken to the nearest primary stroke center for initial stabilization. Communication is key in this process. The ambulance crew or hospital staff immediately contact the receiving hospital's emergency team to alert them about the incoming patient. Many regions use electronic systems that share real-time information about bed availability and hospital capacity, making sure the patient is transferred to a facility ready to provide the needed care. When the patient arrives, the transferring hospital provides a detailed report to the receiving team, including vital signs, neurological status, and treatments given so far. Once a transfer is needed, the hospital staff call the local dispatch center to request an ambulance, often specifying it as a code stroke transfer to prioritize the case. Depending on the patient's condition, they might be accompanied by a nurse or critical care team member during transport, especially if they are receiving treatments like clot-busting medication. Transport time is carefully considered. If the nearest comprehensive stroke center is more than 15 or 20 minutes away, the patient might first go to a closer hospital for initial stabilization before being transferred again. The goal is always to balance the urgency of getting the patient to a place with advanced treatments against the risks of prolonged transport. For patients already receiving clot-busting drugs, it's important they are accompanied by trained medical staff during transfer. If the stroke is hemorrhagic, specific protocols are followed, such as keeping the patient's head elevated and monitoring vital signs closely. During transport, neurological checks are performed every 15 minutes to catch any changes early, and medical teams stay in close contact with the receiving hospital to prepare for immediate intervention upon arrival. Despite these well-established procedures, challenges can slow down transfers. Sometimes hospitals hesitate to accept patients due to capacity issues or uncertainty about eligibility for advanced procedures. Communication gaps between different hospitals or delays in decision-making can also cause setbacks. To improve this, many regions develop standardized protocols and use telemedicine tools like video conferencing to assess patients remotely. Some centers even have dedicated transfer teams or mobile stroke units that can speed up the process by bringing specialized staff directly to the patient or quickly moving them to the right facility. Overall, the system relies on rapid recognition, clear communication, and adherence to evidence-based guidelines. Hospitals within a region coordinate through formal agreements and shared protocols to ensure stroke patients get the fastest, most appropriate care possible. This teamwork is crucial because timely treatment can make a big difference in recovery and long-term outcomes. Always remember, if you or someone else shows signs of a stroke, calling emergency services immediately is the most important step. Medical professionals are trained to evaluate, stabilize, and transfer patients swiftly, ensuring they receive the best care without delay.